NCLEX 3500 practice questions with answers. Question 1. During a community health assessment at a local school's parent-teacher conference, the nurse encounters several parents and caregivers. Based on their shared histories and lifestyles, the nurse determines the risk factors for hypertension among them. Which of the following individuals is at the risk for developing hypertension? Highest. A 45-year-old African-American attorney with a family history of hypertension, who has a sedentary lifestyle, consumes a diet high in sodium, and recently had a significant weight gain. B. A 60-year-old Asian American shop owner with a BMI of 28, who has well-managed type 2 diabetes, takes medications for high cholesterol, and engages in regular physical activity. C. A 40-year-old Caucasian nurse who is a vegetarian, has a healthy BMI, is a non-smoker but reports high levels of work-related stress and consumes excessive amounts of caffeine. D. A 55-year-old Hispanic teacher who smokes occasionally, has a healthy BMI, participates in a moderate-intensity exercise program, and recently started taking oral contraceptives. 5. E. A 50-year-old Middle Eastern engineer with a BMI of 26, who has a family history of cardiovascular diseases, does not engage in any form of exercise, and has recently been diagnosed with obstructive sleep apnea. 6. F. A 52-year-old Native American artist with a family history of kidney disease, who smokes a pack of cigarettes daily, drinks alcohol excessively, and reports infrequent physical activity. African Americans have the highest incidence of hypertension. Risk is increased by sedentary lifestyle, high sodium intake, and obesity. Question 2. A 15-year-old female with a history of depression is brought to the emergency department. 1115. A. Perform gastric lavage. B. Administer acetylcysteine, Mucomyst, orally. C. Start in 4 with dextrose 5% and 0.33% normal saline. D. Have the patient drink activated charcoal mixed with water 5. E. Conduct a psychiatric evaluation. 6. F. Apply wrist restraints to prevent further self-harm. Activated charcoal is a priority for suspected oral ingestions to prevent further absorption. Question 3. A 68-year-old male with a history of hypertension and diabetes has undergone a cardiac catheterization to evaluate potential coronary artery disease. Which complication should the nurse monitor closely during this period? A. Persistent angina despite being at rest and receiving nitroglycerin. B. Thrombus formation leading to decreased peripheral pulses and cyanosis. C. Dizziness accompanied by a sudden drop in blood pressure when standing. D. Gradual decrease in blood pressure with no other symptoms. The most common and serious complication post-cath is thrombus or hematoma formation at the puncture site. Question 4. A 43-year-old male with a history of recurrent renal calculi is admitted. Which nursing goal should be the top priority for this client? A. Maintain fluid and electrolyte balance. B. Control nausea. C. Manage pain. D. Prevent urinary tract infection. Renal colic, stone pain, is often excruciating. Pain management is the immediate priority for patient stability. Question 5. During a school screening program, a 9-year-old girl who is shorter than her peers, what would the nurse expect to see? A. Decreasing amounts of body fat and muscle mass. B. Little change in body appearance from year to year. C. Progressive height increase of 4 inches each year. D. Yearly weight gain of about 5.5 pounds per year. School-age children typically gain about 4.4 to 6.6 pounds per year. Question 6. A 62-year-old client notes that the client's blood pressure is 160/96 mmHg. What would the nurse advise the client to do? A. Go get a blood pressure check within the next 15 minutes. B. Check blood pressure again in 2 months. C. See the healthcare provider immediately. D. Visit the healthcare provider within 1 week for a BP check. Stage 2 hypertension readings require follow-up within 1 week for confirmation and management. Question 7. It's a busy evening shift. The nurse is given 4 clients and must decide who to prioritize for discharge to accommodate new admissions. Who should be considered for discharge? First, A. A middle-aged client with a history of being ventilator dependent for over 7 years and admitted with bacterial pneumonia 5 days ago. B. A young adult with diabetes mellitus type 2 for over 10 years and admitted with antibiotic-induced diarrhea 24 hours ago. C. An elderly client with a history of hypertension, hypercholesterolemia, and lupus, and was admitted with Stevens-Johnson syndrome that morning. D. An adolescent with a positive HIV test and admitted for acute cellulitis of the lower leg 48 hours ago. A patient stable for 5 days after a chronic condition exacerbation, pneumonia, is the best candidate for discharge compared to acute admissions. Question 8. As the nurse educates the client about levothyroxine, Synthroid, which point should be emphasized? A. Should be taken in the morning. B. May decrease the client's energy level. C. Must be stored in a dark container. D. Will decrease the client's heart rate. Taking the medication in the morning on an empty stomach prevents insomnia and optimizes absorption. Question 9. A 3-year-old child was brought to the pediatric clinic, thick muffled voice, croaking on inspiration, sit leaning forward, drooling. What should the nurse do first? A. Prepare the child for X-ray of upper airways. B. Examine the child's throat. C. Collect a sputum specimen. D. Notify the healthcare provider of the child's status. These are classic signs of epiglottitis. Notify the provider immediately and avoid examining the throat to prevent airway closure. Question 10. Suspecting diabetes, which symptom is most likely to prompt parents to seek medical evaluation for their school-age child? A. Polyphagia. B. Dehydration. C. Bedwetting. D. Weight loss. 5. E. A frequent urination during the day. Sudden onset of bedwetting in a toilet-trained child, secondary enuresis, is a common symptom leading to a diabetes diagnosis. Question 11. Which of the following infections is associated with a recurrence of pelvic inflammatory disease, PID, most frequently? A. Trichomoniasis. B. Chlamydia. C. Staphylococcus. D. Streptococcus. 5. E. Gonorrhea. 6. F. Escherichia coli. Chlamydia is the most common cause of PID and subsequent recurrences. Question 12. Among the patients waiting, which client should the charge nurse most appropriately assign to this RN, spinal rehab specialist? A. A middle-aged client who says, I took too many diet pills. B. A young adult who says, I hear songs from heaven. I quit drinking 2 days ago. C. An adolescent who has been on pain medications, terminal cancer with an initial assessment finding pupils and a relaxed respiratory rate of 11. D. An elderly client who reports having taken a large crack hit 10 minutes prior. 5. E. A pregnant woman in her 3rd trimester. The rehab nurse is best suited for the stable, terminal cancer patient. The other cases are acute emergency/withdrawals. Question 13. A 60-year-old male client is admitted, following an angioplasty. What dietary advice should the nurse prioritize? A. Eating 3 balanced meals a day. B. Adding complex carbohydrates. C. Avoiding very heavy meals. D. Limiting sodium to 7 grams per day. Avoiding heavy meals reduces the metabolic demand and workload on the heart immediately post-angioplasty. Question 14. The patient is currently on a morphine pump, which observation indicates that the pump may not be functioning correctly? A. The client complains of discomfort at the 4 insertion site. B. The client states, I just can't get relief from my pain. C. The level of the drug is 100 milliliters at 8 a.m. and is 80 milliliters at noon, despite the patient's frequent requests for PRN doses. D. The level of the drug is 100 milliliters at 8 a.m. and is 50 milliliters at noon. 5. ERR of 8. 6. F. Drop in BP. If the basal rate is 10 milliliters per hour, 40 milliliters should be gone by noon. A drop of only 20 milliliters indicates a malfunction, underdelivery. Question 15. Considering the demographic and the context, chiropractic treatment, in responding, what should be the focus of the nurse's answer? A. Electrical energy fields and their role in pain management. B. Spinal column manipulation and its potential benefits for chronic back pain. C. Mind-body balance and its holistic approach to health. D. Exercise of joints and its importance in maintaining mobility. 5. E. Acupuncture. 6. F. Regular checkups. Chiropractic medicine focuses specifically on the manipulation of the spinal column to treat musculoskeletal pain. Question 16. Which finding should prompt the nurse to take immediate action and possibly escalate care for a post-CVA patient? A. Decrease in the level of consciousness. B. Loss of bladder control. C. Altered sensation to stimuli, especially in the fingers. D. Emotional lability. 5. E. Difficulty coordinating. 6. F. Headache. Decreased lock is the earliest sign of clinical deterioration or increased intracranial pressure. Question 17. Which later stage symptom associated with cystic fibrosis would the nurse not expect to observe at this time in a 6-year-old? A. Positive sweat test. B. Bulky greasy stools. C. Moist, productive cough. D. Meconium ileus 5. E. Clubbing of the fingers and toes 6. F. Sob. Clubbing of the digits is a sign of chronic hypoxia and is typically a late-stage manifestation. Question 18. A male client is lethargic and confused 2 hours after a fall. What action should the nurse prioritize? A. Place a call to the HCP for instructions. B. Arrange for immediate transport or send him to the nearest emergency room. C. Reassure the wife that symptoms are transient. D. Instruct the wife to monitor him. 5. E. Assess signs. 6. F. Calm environment. Lethargy and confusion after head trauma suggest a potential intracranial hemorrhage. Immediate ER evaluation is required. Question 19. Which of the following actions should the nurse take to adequately prepare the client for the cub radiography? A. Instruct the client that they must be NPO for 6 hours. B. Administer an enema the evening before. C. Administer furosemide 20 mg for. D. Reassure the client and inform them that no special preparation is needed. 5. E. Empty bladder. 6. F. Check allergies. A cub, kidney, ureter, bladder, X-ray is a simple abdominal film requiring no special preparation. Question 20. Post-me, why wait 6 weeks before having sexual intercourse? What is the best response by the nurse? A. You need to regain your strength before attempting such exertion. B. When you can climb 2 flights of stairs without problems or feeling short of breath, it is generally safe to engage in activities like sex. C. Have a glass of wine to relax you, then you can try to have sex. D. Your heart needs time to heal. 5. E. Discuss with cardiologist. The ability to climb 2 flights of stairs without symptoms is the standard clinical indicator for safety to resume sexual activity. Question 21. Which client should the triage nurse prioritize to be seen first? A. A 2-month-old infant with a history of rolling off the bed and has bulging fontanelle. B. A teenager who got a singed beard while camping. C. An elderly client with complaints of frequent liquid brown-colored stools. D. A middle-aged client with intermittent pain behind the right scapula. 5. E. Pregnant woman. 6. F. Minor cut. A singed beard indicates potential inhalation injury. Airway management is the highest priority. Question 22. Which statement made by Mia's mother indicates that she has a clear understanding of her daughter's developmental needs at age 2? A. I want to protect my child from any falls. B. I will set limits on exploring the house. C. I understand the need to use those new skills. D. I intend to keep control over our child. According to Erickson, 2-year-olds, autonomy versus shame/doubt, need to exercise their new skills to develop independence. Question 23. What is the most important action for the nurse to take before administering an enteral feeding via the nasogastric feeding tube? A. Verify the correct placement of the tube. B. Check that the feeding solution matches the dietary order. C. Aspirate abdominal contents to determine the amount of last feeding remaining. D. Ensure that feeding solution is at room temperature. Placement verification is critical to prevent aspiration of the feeding into the lungs. Question 24. Mrs. Thompson is receiving an infusion of 40 ml equivalent potassium chloride. Which of the following patterns should prompt you to discontinue the potassium infusion immediately? A. Narrowed QRS complex. B. Shortened PR interval. C. Tall peaked T waves. D. Prominent U waves. Tall peak T waves are a classic sign of hyperkalemia, necessitating the immediate stop of the infusion. Question 25. Nurse Ramirez manages care for Leo, rhabdomyosarcoma. Given the primary site, monitoring the function of which area of the body? A. All striated muscles. B. The cerebellum. C. The kidneys. D. The leg bones. Rhabdomyosarcoma is a malignant tumor arising from cells that normally develop into skeletal, striated, muscle. Question 26. Nurse Parker should prioritize understanding which fundamental goal of Chinese medicine for a patient with colon cancer. A. Achieve harmony. B. Maintain a balance of energy. C. Respect life. D. Restore yin and yang. The foundational principle of traditional Chinese medicine is the restoration of balance between yin and yang. Question 27. Mr. Garcia, systolic blood pressure decreased, heart rate has risen, dizzy spells. Nurse Johnson should advise Mr. Garcia to A. Increase fluids that are high in protein, B. Restrict fluids, C. Force fluids and reassess blood pressure, D. Limit fluids to non-caffeine beverages. For a patient with hypertrophic cardiomyopathy, maintaining blood volume, preload, is essential to prevent outflow tract obstruction. Question 28. When explaining the procedure, Swan-Ganz catheter, and its purpose, Nurse Matthews should emphasize that the catheter will primarily provide information about A. Stroke volume, B. Cardiac output, C. Venous pressure, D. Left ventricular functioning. The Swan-Ganz catheter measures pulmonary artery wedge pressure, which reflects left ventricular end diastolic pressure, functioning. Question 29. Mr. Taylor, unresponsive, monitor shows ventricular fibrillation. What should be her primary intervention? A. Start a peripheral 4, B. Initiate high-quality chest compressions, C. Establish an airway, D. Obtain the crash cart. Immediate chest compressions, CPR, are necessary to maintain circulation until a defibrillator is available. Question 30. Nurse Martinez is tending to Mr. Rodriguez, digoxin, Lanoxin, 0.25 mg daily, metoprolol, low pressure, 25 mg BID. Which finding would be of greatest concern? A. Blood pressure 94/60 mm Hg, B. Heart rate 76 bpm, C. Urine output 50 ml/hour, D. Respiratory rate 16 bpm. The combination of these medications can cause significant hypotension. 94/60 is a low reading that requires communication with the provider. Question 31. A patient with Parkinson's disease, neuromuscular impairment. You observe a nursing assistant performing all of these actions. For which action must you intervene? A. The NA assists the patient to ambulate to the bathroom and back to bed. B. The NA reminds the patient not to look at his feet when he is walking. C. The NA performs the patient's complete bath and oral care. D. The NA sets up the patient's tray and encourages the patient to feed himself. Patients with Parkinson's should be encouraged to perform as much self-care as possible to maintain independence. Question 32. Chronic low back pain. Which statement by the patient indicates that additional teaching is necessary? A. I will avoid exercise because the pain gets worse. B. I will use heat or ice to help control the pain. C. I will not wear high-heeled shoes at home or work. D. I will purchase a firm mattress to replace my old one. Movement and exercise are generally recommended for chronic back pain management. Avoidance leads to muscle weakness. Question 33. Site complains about a severe throbbing headache. BP 168/94 and HR 48/minute diaphoresis. What action should you take first? A. Administer the ordered acetaminophen, Tylenol. B. Check the Foley tubing for kinks or obstruction. C. Adjust the temperature in the patient's room. D. Notify the physician about the change in status. Signs indicate autonomic dysreflexia. Checking for a full bladder, kink tubing, is the priority to remove the noxious stimulus. Question 34. Which patient should you, as charge nurse, assign to a new graduate RN? A. A 28-year-old newly admitted patient with spinal cord injury. B. A 67-year-old patient with stroke 3 days ago and left-sided weakness. C. An 85-year-old dementia patient to be transferred to long-term care today. D. A 54-year-old patient with Parkinson's who needs assistance with bathing. The stable 3-day post-stroke patient is an appropriate assignment for a new grad compared to unstable new admissions. Question 35. A patient with a spinal cord injury at level C3-4 is being cared for in the ED. What is the priority assessment? A. Determine the level at which the patient has intact sensation. B. Assess the level at which the patient has retained mobility. C. Check blood pressure and pulse for signs of spinal shock. D. Monitor respiratory effort and oxygen saturation level. C3-C4 injuries impact the phrenic nerve. Respiratory failure is the most immediate life-threatening risk. Question 36. Which action should you delegate to the nursing assistant when providing nursing care for a patient with PSI? A. Assess the patient's respiratory status every 4 hours. B. Take the patient's vital signs and record them every 4 hours. C. Monitor nutritional status including calorie counts. D. Have the patient turn, cough, and deep breathe every 3 hours. Vitals are within the scope of UAP. Assessment and teaching, TCDB, are the nurse's responsibility. Question 37. Bladder retraining program. What strategies may stimulate the patient to void? Select all that apply. A. Stroke the patient's inner thigh. B. Pull on the patient's pubic hair. C. Initiate intermittent straight catheterization. D. Pour warm water over the perineum. Sensory triggers like stroking the thigh or warm water can stimulate the voiding reflex in some PSI patients. Question 38. Cervical PSI and fixed skeletal traction with a halo fixation device. Delegate which action, S, to the LPN/LVN. Select all that apply. A. Check the patient's skin for pressure from the device. B. Assess the patient's neurologic status for changes. C. Observe the halo insertion sites for signs of infection. D. Clean the halo insertion sites with hydrogen peroxide. LPNs can perform skin checks and site care. Neurologic assessment and infection assessment are RN duties. Question 39. Patient with PSI, I don't know why we're doing all this. My life's over. What additional nursing diagnosis takes priority based on this statement? A. Risk for injury related to altered mobility. B. Imbalanced nutrition, less than body requirements. C. Impaired adjustment to spinal cord injury. D. Poor body image related to immobilization. The statement reflects a lack of coping with the injury, making impaired adjustment the priority psychological diagnosis. Question 40. Which patient should be assigned to the traveling nurse, new to neurologic nursing care, who has been in the neurologic unit for 1 week? A. A 34-year-old patient newly diagnosed with multiple sclerosis, MS. B. A 68-year-old patient with chronic amyotrophic lateral sclerosis, ALS. C. A 56-year-old patient with Guillain-Barré syndrome, GBS, in respiratory distress. D. A 25-year-old patient admitted with CA-level spinal cord injury, PSI. The stable ALS patient is the most appropriate assignment for someone new to the specialty. Question 41. MS patient, too tired to take a bath. What is your priority nursing diagnosis at this time? A. Fatigue related to disease state. B. Activity intolerance due to generalized weakness. C. Impaired physical mobility related to neuromuscular impairment. D. Self-care deficit related to fatigue and neuromuscular weakness. Fatigue is the primary symptom described by the patient as the barrier to self-care. Question 42. What observation would you instruct the LPN/LVN to report immediately in GBS? A. Complaints of numbness and tingling. B. Facial weakness and difficulty speaking. C. Rapid heart rate of 102 beats per minute. D. Shallow respirations and decreased breath sounds. Shallow respirations indicate ascending paralysis affecting the diaphragm, requiring immediate intervention. Question 43. Patient with MG has elevated temp, HR of 120, rise in BP, and was incontinent. What is your best first action? A. Administer an acetaminophen suppository. B. Notify the physician immediately. C. Recheck vital signs in 1 hour. D. Reschedule patient's physical therapy session. These signs indicate a myasthenic or cholinergic crisis, which are medical emergencies. Question 44. Acute hemorrhage stroke husband asks why his wife did not receive alteplase. What is your best response? A. Your wife was not admitted within the time frame. B. This drug is used primarily for acute heart attack. C. Alteplase dissolves clots and may cause more bleeding into your wife's brain. D. Your wife had surgery just 6 months ago. Alteplase is contraindicated in hemorrhagic strokes as it would worsen the active bleeding in the brain. Question 45. Supervising a senior nursing student caring for a patient with a right hemisphere stroke. Which action by the student nurse requires that you intervene? A. The student instructs the patient to sit up straight, resulting in the patient's puzzled expression. B. The student moves the patient's tray to the right side of her overbed tray. C. The student assists the patient with passive range of motion, ROM, exercises. D. The student combs the left side of the patient's hair when the patient combs only the right side. Right hemisphere strokes often cause left-sided neglect. The student should encourage scanning, not accommodate the neglect by moving everything to the right. Question 46. Which of the following arteries primarily feeds the anterior wall of the heart? A. Circumflex artery. B. Internal mammary artery. C. Left anterior descending artery. D. Right coronary artery. The loud supplies the anterior wall and the septum of the heart. Question 47. When do coronary arteries primarily receive blood flow? A. During inspiration. B. During diastole. C. During expiration. D. During systole. Coronary arteries fill primarily during diastole when the myocardium is relaxed. Question 48. Which of the following illnesses is the leading cause of death in the U.S.? A. Cancer. B. Coronary artery disease. C. Liver failure. D. Renal failure. Heart disease, CAD, is the leading cause of death in the U.S. Question 49. Which of the following conditions most commonly results in CAD? A. Atherosclerosis. B. edema, C. ME. D. Renal failure. Atherosclerosis is the primary pathological process leading to coronary artery disease. Question 50. Atherosclerosis impedes coronary blood flow by which of the following mechanisms? A. Plaques obstruct the vein. B. Plaques obstruct the artery. C. Blood clots form outside the vessel wall. D. Hardened vessels dilate to allow the blood to flow through. Plaques build up on the arterial walls, narrowing the channel for blood flow. Question 51. Which of the following risk factors for coronary artery disease cannot be corrected? A. Cigarette smoking. B. EDM. C. Heredity. D. HPN. Heredity, genetics, is a non-modifiable risk factor for CAD. Question 52. Exceeding which of the following serum cholesterol levels significantly increases the risk of coronary artery disease? A. 100 mg/dL. 150 mg/dL. 175 mg/dL. 200 mg/dL. Total cholesterol levels above 200 mg/dL are associated with increased heart disease risk. Question 53. Which of the following actions is the first priority care for a client exhibiting signs and symptoms of coronary artery disease? A. Decrease anxiety. B. Enhance myocardial oxygenation. C. Administer sublingual nitroglycerin. D. Educate the client about his symptoms. Increasing oxygen supply to the heart muscle is the immediate priority during cardiac ischemia. Question 54. Medical treatment of coronary artery disease includes which of the following procedures? A. Cardiac catheterization. B. Coronary artery bypass surgery. C. Oral medication administration. D. Percutaneous transluminal coronary angioplasty. Medication is a medical treatment, catheterization is diagnostic, CABG and PTCA are surgical/procedural. Question 55. Prolonged occlusion of the right coronary artery produces an infarction in which of the following areas of the heart? A. Anterior. B. Apical. C. Inferior. D. Lateral. The RCA typically supplies the inferior wall of the heart. Question 56. Which of the following is the most common symptom of myocardial infarction? A. Chest pain. B. Dyspnea. C. Edema. D. Palpitations. Severe chest pain, crushing/pressure, is the hallmark symptom of ME. Question 57. Which of the following landmarks is the correct one for obtaining an apical pulse? A. Left intercostal space, mid-axillary line. B. Left fifth intercostal space, mid-clavicular line. C. Left second intercostal space, mid-clavicular line. D. Left seventh intercostal space, mid-clavicular line. The apical pulse is found at the fifth intercostal space at the mid-clavicular line. Question 58. Which of the following systems is the most likely origin of pain the client describes as knife-like chest pain that increases in intensity with inspiration? A. Cardiac. B. Gastrointestinal. C. Musculoskeletal. D. Pulmonary. Sharp, pleuritic pain that increases with inspiration is typically pulmonary in origin. Question 59. A murmur is heard at the second left intercostal space along the left sternal border. Which valve area is this? A. Aortic. B. Mitral. C. Pulmonic. D. Tricuspid. The second intercostal space, left sternal border, is the pulmonic area. Question 60. Which of the following blood tests is most indicative of cardiac damage? A. Lactate dehydrogenase. B. Complete blood count. C. Troponin I. D. Creatine kinase. Troponins are highly specific biomarkers for myocardial injury. Question 61. Which action, S, should you delegate to the experienced nursing assistant when caring for a patient with a thrombotic stroke? Select all that apply. A. Assist the patient to reposition every 2 hours. B. Reapply pneumatic compression boots. C. Remind the patient to perform active RUM. D. Check extremities for redness and edema. UAPs can assist with mobility and reapply devices. Assessment of redness/edema is a nurse's responsibility. Question 62. The patient who had a stroke needs to be fed. What instruction should you give to the nursing assistant? A. Position the patient sitting up in bed before you feed her. B. Check the patient's gag and swallowing reflexes. C. Feed the patient quickly. D. Suction between bites. Proper positioning, Highfowler's, is vital for safe feeding to prevent aspiration. Question 63. Bacterial meningitis, severe headache, photophobia, temp of 102.6. Which collaborative intervention must be accomplished first? A. Administer codeine for headache. B. Infuse ceftriaxone, Rosfin, 2000 mg for. C. Give acetaminophen, Tylenol. D. Give furosemide, Lasix. Rapid for antibiotic therapy is the life-saving priority for bacterial meningitis. Question 64. Meningococcal meningitis student nurse action requires that you intervene immediately. A. The student enters the room without putting on a mask and gown. B. The student restricts visits to 10 minutes. C. The student gives a warm blanket. D. Checks pupils every 30 minutes. Droplet precautions are mandatory for meningococcal meningitis to prevent staph exposure. Question 65. Encephalitis/tonic-clonic seizures, delegation to an LPN/LVN, select all that apply. A. Document onset and behaviors. B. Administer phenytoin, Dilantin, 200 mg per daily. C. Teach the patient about oral hygiene. D. Develop a discharge plan. LPNs can administer routine medications. Complex assessment, teaching, and planning are RN duties. Question 66. Implement first if the patient has a seizure. A. Non-rebreather mask at 15L/min. B. Administer lorazepam, Ativan, 1 mg for. C. Turn the patient to the side and protect the airway. D. Assess lock. Side-lying position protects the airway from aspiration during a seizure. Question 67. Phenytoin, Dilantin, simple complex seizures, information obtained will be of greatest concern. A. The gums appear enlarged and inflamed. B. The white blood cell count is 2300/mm3. C. Patient occasionally forgets a dose. D. Patient wants to renew driver's license. A low WBC, leukopenia, is a serious hematologic side effect of phenytoin requiring immediate intervention. Question 68. After receiving a change of shift report at 7 a.m., which of these patients will you assess first? A. 23-year-old with a migraine and severe nausea. B. 45-year-old scheduled for craniotomy in 30 minutes. C. 59-year-old with Parkinson's needing swallowing assessment. D. 63-year-old with multiple sclerosis, temp of 101.8 and flank pain. Potential urosepsis in an MS patient is an acute complication that takes priority. Question 69. Care plan for 78-year-old with Parkinson's, delegate to a nursing assistant, NA. Select all that apply. A. Check for orthostatic changes in pulse and BP. B. Monitor for improvement in tremor after levodopa. C. Remind the patient to allow adequate time for meals. D. Monitor for abnormal movements. UAPs can check vital signs and give routine reminders. Medication monitoring is a nursing role. Question 70. Residents with Alzheimer's, best task to delegate to LPN team leaders. A. Check for improvement in memory. B. Use MMSE to assess residents every 6 months. C. Assist residents to the toilet every 2 hours. D. Develop individualized activity plans. Toileting assistance is an appropriate task for the care team to oversee in an LTC setting. Question 71. Alzheimer's patient husband reports he rarely sleeps to ensure wife doesn't wander. Diagnosis most appropriate. A. Decreased cardiac output. B. Caregiver role strain. C. Ineffective therapeutic regimen management. D. Risk for falls. The husband's exhaustion and the 24/7 care burden define caregiver role strain. Question 72. Dexamethasone, Decadron, for glioblastoma, which assessment information concerns you the most? A. The patient does not recognize family members. B. The blood glucose level is 234 mg/dl. C. The patient complains of a continued headache. D. The daily weight has increased 1 kg. Steroids cause hyperglycemia. A blood sugar of 234 mg/dl requires immediate clinical attention. Question 73. Alcoholic patient fell down the stairs a month ago, gradually less active/sleepier. Implement first. A. Hospital alcohol withdrawal protocol. B. Transfer to radiology for a CT scan. C. Insert a retention catheter. D. Give phenytoin. Lethargy after a head injury in an elderly/alcoholic patient is highly suggestive of a chronic subdural hematoma. CT is the priority diagnostic. Question 74. Best to assign to an RN who has floated from the medical unit. A. 26-year-old with a basilar skull structure and nose drainage. B. 42-year-old with ruptured berry aneurysm. C. 46-year-old with bacterial meningitis, 48 hours ago, and an antibiotic dose due. D. 65-year-old just returned from craniotomy. The stable meningitis patient is the most appropriate and predictable assignment for a float nurse. Question 75. Priority nursing diagnosis for a patient experiencing a migraine headache. A. Acute pain related to biologic and chemical factors. B. Anxiety. C. Hopelessness. D. Risk for side effects. Addressing the severe pain is the primary goal during a migraine. Question 76. Normal 4 days after a sigmoid colostomy when the stool is A. Green liquid. B. Solid formed. C. Loose, bloody. D. Semi-formed. A sigmoid colostomy is in the distal colon where water absorption is high, resulting in solid-formed stool. Question 77. Place the call light for a male client with a right-sided brain attack and left homonymous hemianopsia. A. On the client's right side. B. On the client's left side. C. Directly in front of the client. D. Where the client likes. The call light must be placed on the unaffected side, right, because the patient has lost vision in the left field. Question 78. Male client is admitted, following an accident. What are the first nursing actions? A. Check respiration, circulation, neuro. B. Align spine, pupils, hemorrhage. C. Check respirations, stabilize the spine, check the circulation. D. Assess lock and circulation. Emergency sequence is airway/breathing, C. Spine stabilization, then circulation. Question 79. Nitroglycerin reduces preload and relieves angina by A. Increasing contractility. B. Increasing AV conduction. C. Decreasing contractility and O2 consumption. D. Decreasing venous return through vasodilation. Vasodilation decreases the amount of blood returning to the heart, preload. Question 80. Post-me found unresponsive. Which is the nurse's next action? A. Call for help and note the time. B. Clear the airway. C. Precordial thumps. D. Administer 2 quick blows. Always activate the emergency response system first when finding an unresponsive patient. Question 81. Caring for a client recovering from gastrointestinal bleeding. The nurse should A. 8 hours of uninterrupted sleep. B. Vitals every 2 hours. C. Take food and medications at prescribed intervals. D. Provide milk every 2 to 3 hours. A consistent schedule of meals and meds helps neutralize acid and heal the GI tract. Question 82. Heparin IV for 2 days. The partial thromboplastin time, PTT, is 68 seconds. What should Nurse Carla do? A. Stop the IV infusion. B. Continue treatment as ordered. C. Expect warfarin to increase PTT. D. Increase dosage. 68 seconds is within the typical therapeutic range, 1.5-2.5x control, for heparin. Question 83. Ileostomy. When should the drainage appliance be applied to the stoma? A. 24 hours later. B. In the operating room. C. After the ileostomy begins to function. D. During self-care. Appliance is applied in the oar to protect the skin from caustic ileal enzymes. Question 84. Spinal anesthetic. Position the client in A. Side lying. B. Flat on back. C. Back with knees flexed 15 degrees. D. Flat on stomach. Lying flat helps prevent a spinal headache caused by CSF leakage. Question 85. Several hours after a motor vehicle accident, which assessment data suggest increasing intracranial pressure? A. BP decreased. B. Pulse increased. C. Client is oriented when aroused from sleep and goes back to sleep immediately. D. Anorexia. A change in lock is the most sensitive and earliest indicator of increased ICP. Question 86. 80 years old diagnosed with pneumonia. Which of the following symptoms may appear first? A. Altered mental status and dehydration. B. Fever and chills. C. Hemoptysis and dyspnea. D. Pleuritic chest pain and cough. Elderly patients often present with confusion rather than a high fever during infection. Question 87. Active tuberculosis, TB. Which of the following symptoms will be exhibited? A. Chest and lower back pain. B. Chills, fever, night sweats, and hemoptysis. C. Fever of more than 104 degrees Fahrenheit. D. Headache and photophobia. Classically, TB presents with low-grade fever, night sweats, and bloody sputum. Question 88. 7-year-old, tachypneic and afebrile, non-productive cough. He recently had a cold. Could have A. Acute asthma. B. Bronchial pneumonia. C. COPD. D. Emphysema. Viral infections, colds, often trigger asthma attacks in pediatric patients. Question 89. Morphine sulfate, sleeping and her respiratory rate is 4 breaths/minute. Might have A. Asthma attack. B. Respiratory arrest. C. Seizure. D. Wake up on her own. A respiratory rate of 4 is critically low and precedes respiratory arrest. Question 90. 77-year-old male, normal physiologic change related to aging. A. Increased elastic recoil. B. Increased functional capillaries. C. Decreased residual volume. D. Decreased vital capacity. Vital capacity decreases as lung tissue loses elasticity with age. Question 91. Mr. Rodriguez, urate deposits and joint pain, primarily in men over age 30. A. Septic arthritis. B. Traumatic arthritis. C. Intermittent arthritis. D. Gouty arthritis. Gout is caused by uric acid deposits in the joints. Question 92. Heparin 1,500 units/hour. Infusion contains 25,000 units in 500 milliliters. How many milliliters per hour? A. 15 ml/hour. B. 30 ml/hour. C. 45 ml/hour. D. 50 ml/hour. 1,500 units/25,000 units, asterisk 500 milliliters equals 30 milliliters. Question 93. 76-year-old male right stroke, his left arm is swollen. Which condition may cause swelling? A. Elbow contracture. B. Loss of muscle contraction decreasing venous return. C. DVT. D. Hypoalbuminemia. Muscle pump action is needed for venous return. Hemiplegia removes this action. Question 94. Heberden's nodes are a common sign of osteoarthritis. Which is correct about this deformity? A. Only in men. B. Distal interphalangeal joint. C. Proximal interphalangeal joint. D. Dorsolateral aspect. Heberden's nodes occur at the dip, distal, finger joints. Question 95. Main difference between rheumatoid arthritis and osteoarthritis. A. Osteoarthritis is gender-specific. B. Osteoarthritis is localized, rheumatoid is systemic. C. Osteoarthritis is systemic. D. Dislocations and subluxations. Rheumatoid is a systemic autoimmune disease, OA is a localized wear and tear disease. Question 96. Which statement is true about a cane? A. Walker is better. B. Cane on the affected side. C. Cane on the unaffected side. D. Ambulate without the cane. The cane should be held by the strong, unaffected, side to assist balance. Question 97. No 70/30ths insulin available for 30U dose. Substitute. A. 9U regular and 21U NPH. B. 21U regular and 9U NPH. C. 10U regular and 20U NPH. D. 20U regular and 10U NPH. 70/30ths is 70% NPH and 30% regular. 30% of 30 is 9, 70% of 30 is 21. Question 98. Expect to administer which medication to a client with gout? A. Aspirin. B. Furosemide, Lasix. C. Colchicines. D. Calcium gluconate. Colchicine is specific for treating gouty inflammation. Question 99. Primary hyperaldosteronism, caused by excessive hormone secretion from which gland? A. Adrenal cortex. B. Pancreas. C. Adrenal medulla. D. Parathyroid. Aldosterone is secreted by the adrenal cortex. Question 100. Why are wet to dry dressings used for a diabetic foot ulcer? A. Moist wound environment. B. Protect from trauma. C. Debride the wound and promote secondary intention. D. Prevent microorganisms. Wet to dry dressings mechanically debride the wound when they are removed. Question 101. Acute Addisonian crisis. Which laboratory data would the nurse expect to find? A. Hyperkalemia. B. Reduced bun. C. Hypernatremia. D. Hyperglycemia. Lack of aldosterone causes potassium retention, hyperkalemia, and sodium loss. Question 102. SIAD nursing intervention is appropriate. A. Infusing IV fluids rapidly. B. Encouraging increased oral intake. C. Restricting fluids. D. Administering glucose. Fluid restriction is the cornerstone of SIAD treatment to resolve hyponatremia. Question 103. Determine the effectiveness of efforts to control type 2 diabetes over 3 months. A. Urine glucose. B. Fasting blood glucose. C. Serum fructosamine. D. Glycosylated hemoglobin level. HbA1c provides an average blood sugar level over the past 90 days. Question 104. NPH insulin at 7 a.m. most at risk for hypoglycemic reaction. A. 10 a.m. B. Noon. C. 4 p.m. D. 10 p.m. NPH peaks in 4 to 12 hours. Late afternoon is the peak for a 7 a.m. dose. Question 105. The adrenal cortex is responsible for producing which substances? A. Glucocorticoids and androgens. B. Catecholamines and epinephrine. C. Mineralocorticoids and catecholamines. D. Norepinephrine and epinephrine. Cortex, steroids, glucocorticoids/mineralocorticoids, and androgens. Question 106. Electrolyte disturbance most commonly follows thyroid surgery. A. Hypocalcemia. B. Hyponatremia. C. Hyperkalemia. D. Hypermagnesemia. Accidental parathyroid damage during thyroidectomy causes hypocalcemia. Question 107. Elevated in clients who smoke and can't be used as a general indicator of cancer. A. Acid phosphatase level. B. Serum calcitonin level. C. Alkaline phosphatase level. D. Carcinoembryonic antigen level. SEA is elevated in smokers regardless of cancer presence. Question 108. Characteristic of iron deficiency anemia. A. Night sweats, weight loss. B. Dyspnea, tachycardia, and pallor. C. Nausea, vomiting. D. Itching, rash. Low iron leads to low oxygen transport, resulting in pale skin, high HR, and SOB. Question 109. HIV-positive pregnancy. More teaching is necessary when the client says, A. Baby can get virus from placenta. B. Planning on birth control pills. C. Not everyone gives birth to virus-positive baby. D. I'll need a C-section if I become pregnant. Vaginal delivery is possible if viral load is low. C-section is not a universal requirement. Question 110. Preparing AIDS patient for discharge home, include which instruction? A. Gloves before bathing. B. Sterilize all plates. C. Avoid sharing toothbrushes and razors. D. Avoid shared serving dishes. Blood-to-blood contact, razors/brushes, is the transmission risk to prevent. Question 111. 32-year-old admitted with pernicious anemia, expect which findings? A. Pallor, bradycardia. B. Pallor, tachycardia, and a sore tongue. C. Sore tongue, dyspnea, and weight gain. D. Angina, double vision. Pernicious anemia causes glossitis, sore tongue, and general anemia symptoms. Question 112. Develops dyspnea and hypotension after penicillin, nurse do first. A. Page anesthesiologist. B. Administer epinephrine. C. Administer antidote. D. Indwelling catheter. Epinephrine is the first-line drug for anaphylactic shock. Question 113. Adverse reactions to prolonged aspirin therapy. A. Weight gain. B. Fine motor tremors. C. Respiratory acidosis. D. Bilateral hearing loss. Ototoxicity, hearing loss/tinnitus, is a side effect of long-term high-dose aspirin. Question 114. Adaptive immunity is provided by which type of white blood cell? A. Neutrophil. B. Basophil. C. Monocyte. D. Lymphocyte. B and T lymphocytes provide specific, adaptive, immune responses. Question 115. In an individual with Sjogren's syndrome, nursing care should focus on A. Moisture replacement. B. Electrolyte balance. C. Nutritional supplementation. D. Arrhythmia management. Sjogren's causes extreme dryness of the eyes and mouth. Question 116. Chemotherapy develops abdominal pain, fever, and horse barn smelling diarrhea. Important to order. A. ELISA test. B. Electrolyte panel. C. Stool for Clostridium difficile test. D. Flat plate X-ray. Horse barn odor and diarrhea in an immunocompromised patient strongly suggests C. diff. Question 117. To confirm that the client has been infected with HIV, the nurse expects A. Erosette immunofluorescence. B. Quantification of T lymphocytes. C. ELISA. D. Western blot test with ELISA. Western blot is the confirmatory test used after a positive ELISA screening. Question 118. CBC commonly performed before surgery, seek to identify A. Hepatic dysfunction. B. Urine constituents. C. Abnormally low HCT and HB levels. D. Electrolyte imbalance. CBC checks for anemia and infection before anesthesia and surgical stress. Question 119. While monitoring for the development of disseminated intravascular coagulation, DIC, take note of what? A. Platelet count, point, and PTT. B. Platelet count, blood glucose, WBC. C. Thrombin time, calcium, potassium. D. Fibrinogen, WBC, platelet. DIC consumes clotting factors and platelets, prolonging clotting times. Question 120. Dietary history. Which of the following foods is a common allergen? A. Bread. B. Carrots. C. Orange. D. Strawberries. Strawberries are a frequent cause of hypersensitivity reactions. Question 121. Cardiac surgery, blood pressure measures 126/80 mmHg, nurse determines MAP is A. 46 mm Hg, B. 80 mm Hg, C. 95 mm Hg, D. 90 mm Hg. MAP equals S plus 2D/3. 126 plus 160/3 equals 95.3. Question 122. Chest and stomach pain and black tarry stool, anticipate A. Cardiac monitor, oxygen, CK and LDH levels. B. Point, PTT, fibrinogen. C. Electrocardiogram, CBC, testing for occult blood, comprehensive serum metabolic panel. D. EEG, alkaline phosphatase. Pain and GI bleed require rule-out ME, ECG, and assessment of blood loss, CBC/occult. Question 123. CABG surgery 3 days ago. Decrease in platelet count from 230,000 ul to 5,000 ul is noted. A. Pancytopenia. B. ITP. C. DIC. D. Heparin-associated thrombosis and thrombocytopenia, HAT. HAT, or HIT, is a dangerous reaction to heparin used during heart surgery. Question 124. Improve the platelet count in a male client with idiopathic thrombocytopenic purpura, ITP. A. ASA. B. Corticosteroids. C. Methotrexate. D. Vitamin K. Steroids suppress the immune destruction of platelets in ITP. Question 125. Porcine heart valve replacement. Which type of transplant? A. Allogeneic. B. Autologous. C. Syngeneic. D. Xenogeneic. Xenogeneic transplants are from a different species, pig to human. Question 126. Initial response to the injury in the extrinsic pathway. A. Release of calcium. B. Release of tissue thromboplastin. C. Conversion 12 to XIIA. D. Conversion 8 to VIIA. Extrinsic pathway is triggered by tissue injury releasing tissue factor/thromboplastin. Question 127. Instructions for systemic lupus erythematosus, SLE, include information about which blood dyscrasias. A. Dressler syndrome. B. Polycythemia. C. Essential thrombocytopenia. D. Von Willebrand's disease. Thrombocytopenia is a common hematologic complication of SLE. Question 128. Symptom is most commonly an early indication of stage 1 Hodgkin's disease. A. Pericarditis. B. Night sweat. C. Splenomegaly. D. Persistent hypothermia. Night sweats, fever, and weight loss are early B symptoms of Hodgkin's. Question 129. Francis with leukemia has neutropenia. Which function must be frequently assessed? A. Blood pressure. B. Bowel sounds. C. Heart sounds. D. Breath sounds. Neutropenic patients are at high risk for fatal pneumonia. Lung assessment is vital. Question 130. Neurologic complications of multiple myeloma, MM, usually involve which body system? A. Brain. B. Muscle spasm. C. Renal dysfunction. D. Myocardial irritability. MM causes bone lesions, spinal compression or hypercalcemia can cause spasms/weakness. Question 131. Average length of time from HIV infection to development of AIDS. A. Less than 5 years. B. 5 to 7 years. C. 10 years. D. More than 10 years. The median time to progress to AIDS without treatment is about 10 years. Question 132. Consistent with DIC in heat stroke. A. Low platelet count. B. Elevated fibrinogen levels. C. Low levels of fibrin degradation products. D. Reduced prothrombin time. DIC consumes platelets, levels will be low. Question 133. Drenching night sweats, and weight loss, single enlarged supraclavicular lymph node, probable diagnosis. A. Influenza. B. Sickle cell. C. Leukemia. D. Hodgkin's disease. Painless supraclavicular node plus night sweats plus weight loss equals Hodgkin's lymphoma. Question 134. Gunshot wound emergency blood transfusion. His blood type is AB negative. Safest. A. AB-Rh positive. B. ARH positive. C. ARH negative. D. ORH positive. Rh negative patients should receive Rh negative blood. A is safest from this list. Question 135. All chemotherapy treatments, and teamed when to contact the physician. A. Difficulty sleeping. B. Persistent vomiting and diarrhea. C. Irritable and unhappy. D. Continued hair loss. Vomiting/diarrhea post-chemo lead to dangerous dehydration and imbalance. Question 136. Hard to see Molly Sue with no hair. Best response. A. Looks nice in a hat. B. Don't worry, glad she's alive. C. Cover up your feelings. D. This is only temporary, hair will regrow in 3 to 6 months. Factual reassurance about hair regrowth is therapeutic. Question 137. Brittany undergoing chemotherapy for throat cancer, stomatitis, promote oral hygiene. A frequent mouthwash with normal saline. B. Viscous lidocaine. C. Lemon glycerin swabs. D. Hydrogen peroxide. Normal saline is gentle and cleanses without further mucosal damage. Question 138. For sight is red and swollen and Stacy shouts in pain. First action. A. Notify the physician. B. Flush the foreline. C. Immediately discontinue the infusion. D. Ice pack. Stop the infusion immediately to prevent further extravasation/tissue injury. Question 139. Blue bloater refers to which condition? A. ARDS. B. Asthma. C. Chronic obstructive bronchitis. D. Emphysema. Chronic bronchitis presents with cyanosis, blue, and edema, bloater. Question 140. Pink puffer refers to which condition? A. ARDS. B. Asthma. C. Chronic obstructive bronchitis. D. Emphysema. Emphysema patients are well oxygenated, pink, but struggle to exhale, puffer. Question 141. Respiratory arrest following narcotic analgesic, expect PACO2 to be A. 15 mm Hg, B. 30 mm Hg, C. 40 mm Hg, D. 80 mm Hg. Hypoventilation from narcotics leads to high CO2 retention. Question 142. Timothy, pH 7.16, PACO2 80 mm Hg, PAO2 46, HCO3 24. Result represents A. Metabolic acidosis, B. Metabolic alkalosis, C. Respiratory acidosis, D. Respiratory alkalosis. Low pH plus high CO2 equals respiratory acidosis. Question 143. Chest tightness, sob, tachypnea, decreased lock after new HPN drug, indicate A. Asthma attack, B. Pulmonary embolism, C. Respiratory failure, D. Rheumatoid arthritis. Acute distress plus altered lock equals respiratory failure. Question 144. Rule out cirrhosis, laboratory test indicates liver cirrhosis. A. Decreased RBC, B. Decreased serum acid phosphatase, C. Elevated WBC, D. Elevated serum aminotransferase. AST and ALT are elevated when liver cells are damaged/necrotic. Question 145. Confirmed diagnosis of cirrhosis, increased risk for excessive bleeding because A. Impaired clotting mechanism, B. Varix formation, C. Inadequate nutrition, D. Trauma. The liver produces clotting factors, cirrhosis impairs this production. Question 146. Hepatic encephalopathy clinical manifestation is most common. A. Increased urine output, B. Altered level of consciousness, C. Decreased tendon reflex, D. Hypotension. Ammonia accumulation in the brain leads to altered lock and confusion. Question 147. Lactulose, Patrick suddenly develops diarrhea. Nurse best action. A. See if physician is in hospital. B. Withhold next dose. C. Lower the dosage as ordered so the drug causes only 2 to 4 stools a day. D. Bowel movements needed to reduce sodium. The therapeutic target for lactulose is 2 to 4 soft stools per day. Question 148. Indicates a ruptured abdominal aortic aneurysm. A. Back pain, high BP, B. Severe lower back pain, decreased BP, decreased RBC count, increased WBC count, C. Severe back pain, decreased BP, low WBC, D. Intermittent back pain. Rupture causes severe pain, hemorrhage, low BP/RBC, and stress response, high WBC. Question 149. After cardiac catheterization, large puddle of blood under buttocks. First action. A. Call for help. B. Obtain vital signs. C. Ask the client to lift up. D. Apply gloves and assess the groin site. Assess the site and apply manual pressure immediately to stop the bleed. Question 150. Suitable surgical intervention for a client with unstable angina. A. Cardiac catheterization. B. Echocardiogram, C. Nitroglycerin. D. Percutaneous transluminal coronary angioplasty, PTCA. PTCA, angioplasty, reopens coronary arteries in unstable angina. Question 151. Discharge teaching for the client with leukemia, told to avoid A. Oil-based soaps, B. Flossing between the teeth, C. Intake of salt, D. Using an electric razor. Flossing can cause gum trauma and bleeding in thrombocytopenic leukemia patients. Question 152. Safest method of changing the tracheostomy ties. A. Apply the new tie before removing the old one. B. Have a helper present. C. Hold with non-dominant hand. D. Suture in place. Ensures the airway is never unsecured to prevent accidental decannulation. Question 153. Hourly output from the chest tube was 300 ml. Priority to A. Turning to left side. B. Milking the tube. C. Slowing for infusion. D. Notifying the physician. Drainage 100-200 ml/HR is a sign of hemorrhage. Notify the surgeon immediately. Question 154. Infant tetralogy of Fallot. Anticipate an order for A. Digoxin, B. Epinephrine, C. Aminophylline, D. Atropine. Digoxin helps improve cardiac efficiency in congenital heart defects. Question 155. Self-breast exam. Tail of Spence on diagram. Select where A, B, C, D. The tail of Spence is in the upper outer quadrant extending into the axilla. Question 156. Infant with a ventricular septal defect will A. Tire easily, B. Grow normally, C. Need more calories, D. Susceptible to viral infections. L2R shunting causes pulmonary congestion and high energy expenditure, leading to fatigue. Question 157. Stillborn history. Non-stress test can be ordered for this client to A. Determine lung maturity, B. Measure the fetal activity, C. Show effective contractions on FHR, D. Measure the well-being of the fetus. NST evaluates fetal heart health via accelerations in response to movement. Question 158. Noted on the labor monitor, which action should be taken first? A. Instruct to push, B. Vaginal exam, C. Turn off the Pitocin infusion, D. Semi-Fowler's position. Stop Pitocin first if distress is noted on the monitor to stop uterine contraction pressure. Question 159. Evaluate the cardiac arrhythmia on ECG as A. Atrial flutter, B. Sinus rhythm, C. Ventricular tachycardia, D. Atrial fibrillation. VTach is a life-threatening ventricular rhythm. Question 160. Teach the client that Lovenox, enoxaparin, injections should A. Deltoid muscle, B. Be injected into the abdomen, C. Aspirate, D. Clear air from syringe. Lovenox is a SQ injection administered in the abdominal tissue. Question 161. Correct method of administering Valium 10 mg and Phenergan 25 mg. A. Administer together, B. Administer the medication separately, C. Wait 5 minutes between, D. Question the order. Valium is incompatible with other meds and should not be mixed in a syringe. Question 162. Prevent recurrence of urinary tract infections. A. Douche, B. Void every 3 hours, C. Urinalysis monthly, D. Wipe back to front. Emptying the bladder every 3 hours prevents bacterial stasis/growth. Question 163. Which task should be assigned to the nursing assistant? A. Seclusion, B. Empty Foley of pre-eclamptic client, C. Feeding the client with dementia, D. Ambulating client with fractured hip. UAPs can feed stable patients with chronic conditions like dementia. Question 164. Returns from thyroidectomy. Keep at the bedside. A. Tracheostomy set, B. Padded tongue blade, C. Endotracheal tube, D. Airway. Post-op swelling can cause sudden airway blockage. Tracheostomy set is for emergencies. Question 165. Histoplasmosis is transmitted to humans by A. Cats, B. Dogs, C. Turtles, D. Birds. Histoplasmosis fungi are found in bird and bat droppings. Question 166. First intervention for chest pain and P02 of 89%. A. Morphine, B. Administer oxygen, C. Sublingual nitroglycerin, D. Obtain ECG. Hypoxia, 89%, requires immediate oxygen supply, ABCs. Question 167. Signifies rapid expansion and impending rupture of an abdominal aortic aneurysm. A. Abdominal pain, B. Absent pedal pulses, C. Chest pain, D. Lower back pain. Severe lower back pain indicates the aneurysm is leaking or stretching nerves. Question 168. Cardiomyopathy where cardiac output remain normal. A. Obliterative, B. Restrictive, C. Dilated, D. Hypertrophic. In hypertrophic CM, the heart pumps well initially despite the thickened muscle. Question 169. Priority first when treating chest pain while walking. A. Have the patient sit down, B. Get the patient back to bed, C. Obtain ECG, D. Sublingual nitroglycerin. Stop the activity, reduce O2 demand, immediately. Question 170. Positions best aid breathing for acute pulmonary edema. A. Lying flat, B. Left side lying, C. High Fowler's position, D. Semi-Fowler's. Upright positioning reduces venous return and improves lung expansion. Question 171. Abruptio placentae at 34 weeks, risk for which blood dyscrasias? A. HAT, B. ITP, C. Thrombocytopenia, D. Disseminated intravascular coagulation, DIC. Abruptio placentae is a leading trigger for DIC due to tissue factor release. Question 172. Fractures of pelvis and legs severe hypotensive, choice for current condition. A. PRBCs, B. 0.9% NS, C. Lactate Ringer's solution, D. FFP. LR is the preferred isotonic crystalloid for trauma volume resuscitation. Question 173. Corticosteroids suppress A. Cushing syndrome, B. Pain receptors, C. Immune response, D. Neural transmission. Steroids are powerful immunosuppressants. Question 174. Zidovudine, AZT, action best describes. A. Stimulates immune system, B. Kills virus wall, C. It interferes with viral replication, D. Promotes excretion. AZT is an NRTI that stops the virus from replicating. Question 175. Pneumonia persistent cough, reduce discomfort. A. Hold cough, B. Head flat, C. Restrict fluids, D. Splinter chest wall with a pillow for comfort. Splinting the chest reduces muscle strain and pain during coughing. Question 176. Acute asthma distress, RR44, action take first. A. Medical history, B. Give a bronchodilator by nebulizer, C. A cardiac monitor, D. Emotional support. Airway/breathing priority, administer the bronchodilator first. Question 177. Extinguishing house fire, severe hypoxia 48 hours later, condition most likely. A. Atelectasis, B. Pneumonia, C. Bronchitis, D. Acute respiratory distress syndrome, ARDS. Smoke inhalation damage to lungs often results in ARDS within 24 to 48 hours. Question 178. Pneumothorax no longer needs a chest tube. A. Drainage, B. ABG's normal, C. X-ray shows lung 35% deflated, D. The water seal chamber doesn't fluctuate when no suction is applied. Lack of titling in the water seal indicates the lung is fully re-expanded. Question 179. Prevent foot drop and contractures in a patient recovering from subdural hematoma. A. High-top sneakers, B. Low-dose heparin, C. Physical therapy, D. SCDs. High tops keep the feet in dorsiflexion to prevent Achilles shortening. Question 180. Increased ICP would appear first after head trauma. A. Bradycardia. B. Dilute urine. C. Restlessness and confusion. D. Widened pulse pressure. Log changes, restlessness/confusion, are the earliest signs of rising ICP. Question 181. 21-year-old Hodgkin's lymphoma, diagnoses would be a priority. A. Sexual dysfunction. B. Grieving. C. Tissue integrity. D. Fatigue related to chemotherapy. Fatigue is the most debilitating side effect affecting daily function in lymphoma. Question 182. Autoimmune thrombocytopenic purpura, monitor. A. Platelet count. B. WBC count. C. Potassium. D. PTT. IDP involves the destruction of platelets. Question 183. Platelet count currently is 80,000, important to teach. A. Bleeding precautions. B. Falls. C. Oxygen. D. Energy conservation. Counts below 100,000 increase bleeding risk, counts below 20,000 are critical. Question 184. Transsphenoidal hypophysectomy interventions appropriate. A. Trendelenburg. B. Coughing/deep breathing. C. Elevate the head of the bed 30 degrees. D. Valsalva maneuver. Elevating the Hob reduces ICP and helps surgical drainage. Question 185. Diabetes insipidus, polyuria, polydipsia, and mental confusion. Priority intervention. A. Urinary output. B. Check the vital signs. C. Increased fluid intake. D. Weigh the client. Hemorrhage/dehydration risk. Check vitals for signs of shock. Question 186. Hemophilia nosebleed nursing action most appropriate. A. Head hyperextended. B. Pack Marys. C. Pinch the soft lower part of the nose for a minimum of 5 minutes. D. Ice packs. Standard direct pressure is the best way to stop epistaxis. Question 187. Unilateral adrenalectomy, most important measurement in immediate post-op. A. Blood pressure. B. Temperature. C. Output. D. Specific gravity. Hormonal shifts, catecholamine/cortisol, post-adrenal surgery cause unstable BP. Question 188. Addison's disease receiving 4 glucocorticoids, which interventions? A. Daily weights. B. IO. C. Electrolytes. D. Glucometer readings as ordered. Corticosteroids naturally increase blood glucose levels. Question 189. Thyroidectomy, tingling around the mouth and fingers, next action. A. Crash cart. B. Check the calcium level. C. Assess dressing. D. Assess BP. Tingling indicates hypocalcemia from parathyroid damage. Question 190. Hypothyroidism, pulse 52, weight gain, cold, priority. A. Mobility. B. Hypothermia. C. Thought processes. D. Decreased cardiac output or /T bradycardia. Heart rate of 52 is dangerous and takes priority for hemodynamic stability. Question 191. Arteriogram, I'm feeling really hot, response best. A. Allergic reaction. B. That feeling of warmth is normal when the dye is injected. C. Clots dissolving. D. Tell doctor. Warn patients that contrast dye causes a sudden warm, flushed feeling. Question 192. Need for further teaching in healthcare worker. A. Na wears gloves for bath. B. Nurse wears goggles for blood draw. C. Doctor washes hands. D. The nurse wears gloves to take the client's vital signs. Gloves are not required for simple vital signs unless in contact with body fluids. Question 193. ECT has been effective. A. Loss of consciousness. B. Vomiting. C. Tachycardia. D. The client has a grand mal seizure. A generalized seizure is the therapeutic goal of ECT. Question 194. Collect a specimen for pinworms, enterobiasis. A. Examine perianal area with a flashlight 2 to 3 hours after a sleep. B. Scrape skin. C. Stool specimen, D. Hair sample. Pinworms lay eggs outside the anus at night while the child is still. Question 195. Instruction regarding pinworm medication. A. Not for under 10. B. The entire family should be treated. C. Continue for 1 year. D. For antibiotics. Pinworms are highly contagious, whole households require treatment. Question 196. Which client should be assigned to the pregnant nurse? A. The client receiving linear accelerator radiation therapy for lung cancer. B. Radium implant. C. Soluble brachytherapy. D. Iridium seeds. External beam radiation, linear accelerator, does not make the patient radioactive. Question 197. Assigned to a private room if only one is available. A. The client with Cushing's disease. B. Diabetes. C. Acromegaly. D. Myxedema. Cushing's involves high cortisol which suppresses immunity. They need protection from infection. Question 198. Adult strength digitalis to 3-pound infant, baby suffers damage. Charged with A. Negligence. B. Tort. C. Assault. D. Malpractice. Malpractice is professional negligence leading to patient harm. Question 199. Assignment should not be performed by the LPN. A. Foley catheter. B. Discontinuing ing tube. C. Sputum specimen. D. Starting a blood transfusion. Blood administration is strictly an RN responsibility. Question 200. Returns from surgery BP 90 50ths, pulse 132, respirations 30. Priority action. A. Monitor. B. Contacting the physician. C. Ask how he feels. D. Ask LPN. Signs of shock, low BP, high HR, require immediate medical intervention. Question 201. Assigned to care for postpartum client with preeclampsia. A. RN 2 weeks express. B. The RN with 3 years of experience in labor and delivery. C. RN surgery. D. RN NICU. L&D nurses are experts in magnesium sulfate and preeclampsia management. Question 202. Reported to the State Board of Nursing. A. No Spanish literature. B. The narcotic count has been incorrect on the unit for the past 3 days. C. Itemized bills. D. Na fails to feed. Narcotic discrepancy suggests theft or gross negligence, a board matter. Question 203. Suspected of charting medication not given. Charge nurse should A. Call board. B. File a formal reprimand. C. Terminate. D. Charge with tort. Documentation falsification is a serious administrative violation requiring a formal reprimand. Question 204. Home health nurse seen first. A. Peg tube. B. Pneumonia child. C. MRSA vancomycin. D. Exacerbation of multiple sclerosis with cortisone via central venous catheter. Acute exacerbation plus central line access requires priority assessment. Question 205. Assigned to share a room in the ED during a tornado. A. Schizophrenic and colitis. B. 6 months pregnant with abdominal pain and client with facial laceration/broken arm. C. Fixed pupils and frontal injury. D. Puncture wound and chest pain. The pregnant client and trauma client are stable and non-contagious. Question 206. Essential to consider before eye drops for 6-year-old conjunctivitis. A. The eye should be cleansed with warm water removing any exudate. B. Child instills. C. Mother instills. D. Hold of clear. Cleaning exudate first allows the medication to contact the eye surface. Question 207. Meal planning mother of 2-year-old toddler statement needs further instruction. A. White grape juice. B. Grilled cheese. C. Bought hot dogs to grill for his lunch. D. Ice cream. Hot dogs are a significant choking hazard for toddlers unless cut specifically. Question 208. 2-year-old toddler hospital nursing interventions. A. Parent leave. B. Blanket home. C. Ask the parent/guardian to room in with the child. D. Stop screaming. Rooming in reduces separation anxiety in toddlers. Question 209. Instruction for behind-the-ear hearing aid. A. Clean weekly. B. Warm place. C. Toothpick. D. Change the batteries weekly. Batteries require regular weekly changes for consistent performance. Question 210. Priority nursing diagnosis following a tonsillectomy. A. Body image. B. Communication. C. Risk for aspiration. D. Pain. Post-op bleeding and secretions in the airway are the priority risk. Question 211. Primary hyperparathyroidism expect in laboratory findings. A. Elevated serum calcium. B. Low PTH. C. Vitamin D. D. Low urine calcium. Excess PTH pulls calcium into the blood. Question 212. Addison's disease diet modifications not recommended. A. Grains. B. Caloric intake. C. High protein. D. A restricted sodium diet. Addison's needs high sodium due to mineralocorticoid deficiency. Question 213. Diabetic post-op nausea confused and shaky. Most likely explanation. A. Anesthesia. B. Hyperglycemia. C. Hypoglycemia. D. DKA. Confusion/shakiness are signs of low blood sugar. Question 214. Colonoscopy reports increasing abdominal pain, fever, and chills. Most immediate concern. A. Bowel perforation. B. Gastroenteritis. C. Colon cancer. D. Diverticulitis. Pain and fever post-invasive bowel procedure equals perforation. Question 215. Laboratory tests assesses coagulation. Select all that apply. A. Partial thromboplastin time. B. Prothrombin time. C. Platelet count. D. Hemoglobin. PTT, point, and platelets assess the clotting cascade. Question 216. Telemetry ventricular fibrillation. Correct placement of conductive gel pads. A. Clavicle/sternum. B. Midline/shoulder. C. Sternum halves. D. Right of sternum below clavicle and left of precordium. Standard placement for current to travel through the heart apex. Question 217. Clicks and gurgles. Swishing or buzzing sound. Statement is correct. A. A frequency varies. B. Obstruction sounds louder. C. Brood is not normal. D. All of the above. All listed abdominal sound descriptions are clinically accurate. Question 218. Household cleaner in eye. Priority. A. Irrigate the eye repeatedly with normal saline solution. B. Fluorescein. C. Patch. D. Visual acuity. Wash the chemical out immediately to prevent tissue damage. Question 219. Hip replacement concerned about most. A. Pain repositioning. B. Scant discharge. C. Pain after point. D. Temperature of 101.8 F. Significant post-op fever suggests infection or DVT. Question 220. Uncontrolled seizure disorder. Action would not be included. A. Notify physician. B. Restrain the patient's limbs. C. Side lying. D. Rectal diazepam. Restraining during a seizure causes fractures or soft tissue damage. Question 221. Injection of epoetin findings in CBC several days later. A. Neutrophil. B. An increase in hematocrit. C. Platelet. D. Iron. Epoetin alpha stimulates RBC production, hematocrit. Question 222. Polycythemia vera symptom consistent? Select all that apply. A. Weight loss. B. Clotting time. C. Hypertension. D. Headaches. Thick blood, viscosity, leads to high BP and headaches. Question 223. Platelet count of 20,000/microliter intervention. A. Observe for spontaneous bleeding. B. Limit family. C. Aspirin. D. Immune precautions. Critical low platelets, 20K, require monitoring for brain/GI bleeds. Question 224. Typical side effect of long-term corticosteroid treatment? Select all that apply. A. Hypertension. B. Cushingoid features. C. Hyponatremia. D. Albumin. Steroids cause moon face and high BP. Question 225. Most important nursing action when caring for a neutropenic patient. A. Mask. B. Change gloves immediately after use. C. Minimize contact. D. Minimize conversation. Gloves prevent the spread of bacteria from staff to the patient. Question 226. Most accurate regarding immunizations. A. All diseases. B. Natural. C. Risk-free. D. Immunization provides acquired immunity from some specific diseases. Vaccines create artificially acquired active immunity. Question 227. Severe bee sting allergic reaction oral swelling. Most urgent. A. Consult. B. Maintain a patent airway. C. Epinephrine. D. Benadryl. Airway closure, edema, is the immediate threat to life. Question 228. Side effects typically related to medications used for ADHD. Select all that apply. A. Poor appetite. B. Insomnia. C. Sleepiness. D. Agitation. Stimulants, ADHD meds, cause wakefulness, reduced hunger, and jitters. Question 229. Haldol, abnormal movements of her face and tongue. Symptoms. A. Depression. B. Hallucinations. C. Negative symptoms. D. Tardive dyskinesia. TD is a permanent movement disorder from long-term antipsychotics. Question 230. Symptoms indicative of hypoglycemia. A. Polydipsia. B. Confusion. C. Blurred vision. D. Polyphagia. The brain requires glucose. Confusion is an early neuroglycopenic sign. Question 231. Wilms tumor, stage 2 describes. A. Less than 3 centimeters. B. Not beyond kidney. C. The tumor extended beyond the kidney but was completely resected. D. Cannot be resected. Stage 2 is regional spread but surgically removable. Question 232. Acute glomerulonephritis findings? Select all that apply. A. SG 1.040. B. Urine 350 milliliters in 24 hours. C. Brown, // T-colored // urine. D. Generalized edema. Low output, hematuria, and edema are the triad of NGN. Question 233. Most commonly causes acute glomerulonephritis. A. Congenital. B. Prior infection with group A Streptococcus 10 to 14 days ago. C. Viral. D. Nephrotic. NGN is a post-strep immune reaction. Question 234. Hydrocele at 1 month scrotal fluid still visible, recommended. A. Massage. B. Surgeon. C. No treatment is necessary, the fluid is reabsorbing normally. D. Flat supine. Hydroceles usually resolve by age 1. Question 235. PVD burning and tingling of the hands and feet, most likely explanation. A. Inadequate tissue perfusion leading to nerve damage. B. Fluid overload. C. A psychiatric. D. Inflammation. Ischemia, low blood flow, damages the peripheral nerves. Question 236. Hepatitis a most likely route of transmission. A. Sexual. B. Contaminated food. C. Transfusion. D. Drugs. Hep A is fecal-oral, food/water. Question 237. Blood donor medical conditions would prevent this. A. History of hepatitis C 5 years ago. B. Cholecystitis. C. Diverticulosis. D. Crohn's. Hepatitis C is a permanent disqualifier for blood donation. Question 238. Medications would be contraindicated for acute gastritis. A. Naproxen sodium, naproxen. B. Calcium carbonate. C. Clarithromycin. D. Furosemide. NSAIDs, naproxen, irritate and erode the stomach lining. Question 239. Information important to communicate for cholecystitis. A. Low calorie. B. High protein. C. Limit sweets. D. The patient should limit fatty foods. Fat causes the gallbladder to contract, causing pain. Question 240. Myocardial infarction pulmonary edema exhibit A. Slow respirations, B. stridor, C. bradycardia, D. air hunger. Pulmonary edema blocks oxygen intake, patient gasps for air. Question 241. Most likely present in a client with mitral regurgitation. A. Altered lock, B. Exertional dyspnea, C. CPK concentration, D. Chest pain. Backflow into the atrium causes pulmonary congestion and sob. Question 242. Figure out whether current problem is of renal origin, urinary burning, assess A. Meatus, B. labium, C. suprapubic, D. right or left costovertebral angle. CVA tenderness is diagnostic for kidney involvement. Question 243. Best indicator of renal function. A. Blood pressure, B. Consciousness, C. Distension, D. Pulse. Renal health is tied directly to BP regulation, RAAS system. Question 244. Documents uncontrollable jerking movements type of seizure. A. Tonic, B. Absence, C. Myoclonic, D. Clonic seizure. Clonic equals rhythmic jerking, tonic equals stiffening. Question 245. Berger's disease anticipates nicotine, nicotrol, prescription. A. Paracetamol, B. Ibuprofen, C. Nitroglycerin, D. Nicotine, nicotrol. Smoking is the cause, cessation is the only treatment. Question 246. Raynaud's disease is characterized by A. Capillaries, B. Veins, C. Aorta, D. Episodic vasospastic disorder of the small arteries. Vasospasm of small arteries causes the white/blue/red color change. Question 247. Glucose self-monitoring is preferred to urine testing because A. More accurate, B. Done by client, C. Easy, D. Drugs. Blood testing gives real-time glucose, urine is delayed. Question 248. Diuretic therapy. Jesse weighs 205.5 from 210. Estimate fluid lost. A. 0.3 L, B. 1.5 L, C. 2.0 L, D. 3.5 L. For 0.5 pounds lost /2.2 equals 2.0 liters. Question 249. Fluid shift with administration of albumin occurs in A. Osmosis, B. Diffusion, C. Active transport, D. Filtration. Albumin, protein, pulls water into the blood via osmotic pressure. Question 250. Complication associated with crutch walking. A. Leg discomfort, B. Weak biceps, C. Tricep spasm, D. Forearm weakness. Radial nerve damage, crutch palsy, causes forearm/wrist weakness. Question 251. Neutropenic client should avoid A. Oral hygiene, B. Using suppositories or enemas, C. Perineal hygiene, D. Filter mask. Rectal trauma from enemas can introduce bacteria into the blood. Question 252. Perforated peptic ulcer schedule for surgery, place client in A. Sims, B. Supine, C. Semi-Fowler's position, D. Dorsal recumbent. Semi-Fowler's helps pull gastric leaks and improves lung expansion. Question 253. Ensures adequate ventilating exchange after surgery. A. Remove airway when conscious, B. Auscultate, C. Position client laterally with the neck extended, D. Humidified oxygen. Lateral position with neck extension prevents tongue obstruction. Question 254. Thoracic surgery excessive bubbling in the water seal chamber. A. Strip tube, B. Check the system for air leaks, C. Functioning correctly, D. Decrease suction. Continuous bubbling indicates a hole/leak in the drainage circuit. Question 255. Teachings are effective for sodium restriction if client states A. Celery, B. Scallops, C. I can eat shredded wheat cereal, D. Spaghetti on rye. Shredded wheat is naturally very low in sodium. Question 256. Ascites in cirrhosis is most likely the result of increased A. Pressure in the portal vein, B. Production of albumin, C. Bile salts, D. Osmotic pressure. Portal hypertension pushes fluid out of the liver/vessels. Question 257. Hodgkin's excisional cervical lymph node biopsy, assess first. A. Vitals, B. Incision, C. Airway, D. Lock. Neck swelling post-biopsy can crush the airway. Question 258. Finding indicates hypovolemic shock. A. Systolic blood pressure less than 90 mm Hg, B. Pupils unequally dilated, C. RR4, D. Pulse 60. Hypotension, 90 systolic, is the indicator of shock. Question 259. Rhinoplasty preoperative teaching. A. Noticeable immediately, B. NS drops, C. Packing 10 days, D. Aspirin-containing medications should not be taken 14 days before surgery. Aspirin increases the risk of uncontrollable nasal bleeding during surgery. Question 260. Diabetic ketoacidosis, DKA, initial treatment. A. Regular insulin, B. Potassium, C. Bicarb, D. Calcium. For regular insulin is the only way to stop ketone production. Question 261. Food sources of vitamin E and beta-carotene. A. Fish, B. Oranges, C. Carrots, D. Spinach and mangoes. Leafy greens and mangoes contain high levels of these antioxidants. Question 262. GERD. After every meal, the client should A. Rest in a sitting position, B. Walk, C. Drink water, D. Lie down. Gravity prevents acid from flowing back into the esophagus. Question 263. Adaptation that indicates major complication after gastroscopy. A. Nausea, B. Abdominal distension, C. GI motility, D. Swallowing. Distension indicates a perforated stomach from the scope. Question 264. Cholecystectomy dietary teaching well understood. A. High protein, B. Avoid foods that upset me, C. Avoid fatty foods forever, D. Most people can tolerate regular diet after this type of surgery. The body adapts to the lack of a gallbladder, fat digestion continues. Question 265. Hepatitis A untoward sign report immediately. A. Restlessness, B. Yellow urine, C. Nausea, D. Clay-colored stools. Stools without color indicate bile obstruction, worsening liver failure. Question 266. Anti-tuberculosis drugs can damage the 8th cranial nerve. A. INH, B. PA, C. Ethambutol, D. Streptomycin. Streptomycin is ototoxic, 8th nerve damage. Question 267. Peptic ulcers are the result of A. Genetic, B. Stress, C. Diet, D. Helicobacter pylori infection. H. pylori bacteria cause most gastric and duodenal ulcers. Question 268. Subtotal gastrectomy, nasogastric tube drainage color 12 to 24 hours after A. Green, B. Bright red, C. White, D. Dark brown. Bright red blood should transition to old, dark brown blood after 12 hours. Question 269. Eye surgery activities permitted? Best. A. Watching circus, B. Bending, C. Watching TV, D. Lifting. TV is low impact, circuses, eye tracking, and bending, ICP, are harmful. Question 270. Injured leg shorter than the other leg, painful, swollen and ecchymotic. Interprets. A. Fracture, B. Strain, C. Sprain, D. Contusion. Bone shortening and deformity are classic for fractures. Question 271. Infant findings warrants further investigation? Select all that apply. A. Abdominal respirations. B. Irregular breathing. C. Inspiratory grunt. D. Nasal flaring. E. Cyanosis. Grunting/flaring are signs of respiratory distress. Question 272. Primarily linked to the post-mature status of the fetus. A. Weight. B. Sugar. C. Fat. D. Progressive placental insufficiency. Old placentas cannot feed/oxygenate the fetus well. Question 273. Total hip replacement concerning/necessitates immediate intervention. A. Muscle spasms. B. I just can't catch my breath over the past few minutes. C. Bedpan. D. Meds not working. Sudden sob in post-op hip patient equals pulmonary embolism. Question 274. Furosemide, negative side effect from the furosemide. A. I was surprised to see my weight jump up by 5 pounds. B. Swelling. C. Upset stomach. D. Appetite. A. Question 275. Pregnant woman twins at home and a miscarriage at 12 weeks. Document. A. Gravida 2 para 1. B. G3P2. C. Gravida 3 para 1. D. G2P2. Current, 1, plus twins, 1, plus miscarriage, 1, equals G3. Twins equals 1 para, miscarriage equals 0 para. Question 276. Venous stasis ulcer intervention most effective. A. Sterile technique. B. Improve the client's nutrition status. C. Compression. D. Debridement. Systemic weight loss/fatigue means the body can't heal without nutrients. Question 277. Effective reward feedback system. A. Provide specific feedback immediately after a task. B. Equal amounts. C. Compliment first. D. High expectations. A. Question 278. MS patient additional teaching if makes which statement? Select all that apply. A. Weightlifting. B. I believe it's essential to exercise to the point of exhaustion. C. Aerobic. D. Stretch. 5. E. Without breaks. Exhaustion and lack of breaks trigger MS flare-ups. Question 279. Alzheimer's care evaluation prioritize utmost importance. A. 2 meals. B. Support group. C. Understanding the risk, we'd installed safety bars and set up 24-hour alarms. D. Pillbox. Safety and prevention of wandering are the top priorities. Question 280. Medication contraindicated if the patient were pregnant? Select all that apply. A. Warfarin, Coumadin. B. Finasteride. C. Celecoxib. D. Clonidine. 5. E. Nicotine. Warfarin and finasteride are high-risk teratogens. Question 281. Drugs associated with photosensitive reactions? Select all that apply. A. Ciprofloxacin, Cipro. B. Sulfonamide. C. Norfloxacin, Norexin. D. Bactrim. 5. E. Accutane. All these drugs require the patient to stay out of the sun. Question 282. Urine discoloration least likely to cause. A. Sulfasalazine. B. Levodopa. C. Phenolphthalein. D. Aspirin. Aspirin does not alter urine color. Question 283. Replaced due to incorrect storage, fridge. A. Nadolol, Corgard. B. Humulin N. C. Urokinase. D. Epoetin. 5. E. Glargine. Corgard is a room temperature medication. Question 284. Immunoglobulins protection to the fetus in the womb. A. IgA. B. IgD. C. IgA. D. IgG. IgG is the only antibody to cross the placenta. Question 285. Significant action after needle stick incident, AIDS. A. Social worker. B. Start prophylactic AZT treatment as soon as possible. C. Pentamidine. D. Counseling. 5. E. Incident report. 6. F. Testing. PEP, post-exposure prophylaxis, must be started immediately, within 2 hours. Question 286. Fatigue, inability to urinate for the past 24 hours. Suspect A. Atherosclerosis, B. Nephropathy, C. Autonomic neuropathy, D. Somatic. Diabetic neurogenic bladder is an autonomic complication. Question 287. Inability to eat, vomiting after meals, severe constipation, ballet dancer. Suspect A. Multiple sclerosis, B. Anorexia nervosa, C. Bulimia nervosa, D. Systemic sclerosis. Induced vomiting is the key marker for bulimia. Question 288. Myeloma diagnosis reports constipation, intense abdominal pain, and polyuria. Suspect A. Diverticulosis, B. Hypercalcemia, C. Hypocalcemia, D. IBS. Question 289. Regam most likely be administered to prevent hemolytic disease. A. Mother Rh+, infant Rh+, B. Mother Rh+, infant Rh-. C. When the mother is Rh negative and the infant is Rh positive. D. Mother Rh-, infant Rh-. Regam prevents the Rh mother from attacking Rh+ fetal cells. Question 290. PKU statement made by a nurse would not be correct. A. Guthrie test, B. High concentration in urine, C. Mental deficits, D. The effects of PKU, once manifested, are completely reversible. Damage from PKU is permanent and non-reversible. Question 291. CHF aspirin overdose nurse most closely monitor. A. Onset of pulmonary edema, B. Alkalosis, C. Respiratory alkalosis, D. Parkinson's. Salicylate poisoning causes pulmonary fluid shifts, dangerous in CHF. Question 292. Charge nurse primary responsibility for blind/deaf patient post-op. A. Let others know, B. Supervisor concerns, C. Update on environment, D. Provide a secure environment for the patient. Safety is the priority for patients with sensory loss. Question 293. Best instruction for COPD climber stairs. A. Deep breathing, B. Cough before, C. Use a bronchodilator and wait for a few minutes, then cough, D. Decrease CO2. Bronchodilate first, then clear mucus to maximize stair climbing. Question 294. 6-month-old infant congenital heart defect clinical signs most likely. A. Slow pulse, B. Weight gain, C. Decreased systolic pressure, D. Increased respiratory rate. Tachypnea is the hallmark of pediatric heart failure. Question 295. Not typically associated with Down syndrome. A. Simian crease, B. Brachycephaly, C. Oily skin, D. Hypotonicity. Down syndrome skin is typically dry and prone to irritation. Question 296. Tissue plasminogen activator therapy prioritize. A. Neuro changes, B. Renal failure, C. Food diary, D. Observe for signs of bleeding. Bleeding is the number one risk of clotbuster (TPA) therapy. Question 297. Highest concentration of folic acid. A. Green vegetables like spinach and broccoli, B. Yellow, C. Carrots, D. Milk, 5. E. Citrus, 6. F. Whole grains. Folic acid, folate, is highest in dark leafy greens. Question 298. Not being linked to meningitis. A. S. Pneumoniae, B. H. Influenza, C. N. Meningitis, D. C. L. difficile. C. Diff is a bowel pathogen, not a brain pathogen. Question 299. How long does a typical red blood cell live? A. 45, B. 60, C. 90, D. 120 days. RBCs recycle every 120 days. Question 300. Hereditary risk factors for developing atherosclerosis. A. Family history of heart disease, B. Overweight, C. Smoking, D. Age. Genetic/family history is the hereditary component. Question 301. Claudication fact is correct? Select all that apply. A. Oxygen demand supply. B. Rest pain. C. Tissue hypoxia. D. Cramping and weakness. Claudication is intermittent. Pain at rest means it has worsened to rest pain. Question 302. Peripheral vascular disease discharge instructions. A. Barefoot. B. Heating pad. C. Avoid crossing the legs. D. Antibacterial ointment. Crossing legs stops blood flow in PVD patients. Question 303. Raynaud's disease description is most likely to fit the patient. A. Adolescent male. B. Elderly woman. C. A young woman. D. Elderly man. Raynaud's primarily affects women in their 20s and 30s. Question 304. 27th week pregnancy 6 days bed rest sob/chest pain. Most likely cause. A. Me. B. Pulmonary embolism due to deep vein thrombosis, DVT. C. Anxiety. D. CHF. Stasis plus pregnancy equals high risk for DVT/PE. Question 305. Significant complication associated with thrombolytic therapy. A. Air embolus. B. Cerebral hemorrhage. C. Expansion. D. Resolution. Clotbusters often cause brain bleeds. Question 306. Holds head in unusual position faces to one side. Most likely. A. Torticollis, with shortening of the sternocleidomastoid muscle. B. Craniosynostosis. C. Plagiocephaly. D. Hydrocephalus. Rhineck, torticollis, pulls the head to the side. Question 307. Osgood-Schlatter disease statement is correct. A. Swimming. B. Surgery. C. The student experiences pain in the inferior aspect of the knee. D. Physical education avoidance. Pain is at the tibial tubercle, below the kneecap. Question 308. Bend forward arms hanging freely. Conducting assessment most likely. A. Flexibility. B. Leg length. C. BP. D. Scoliosis. The Adams forward bend test checks for spine curvature. Question 309. Found in an abusing parent? Least likely. A. Low self-esteem. B. Unemployment. C. Self-blame for the injury to the child. D. Single status. Abusers blame the victim or external factors, not themselves. Question 310. Juvenile idiopathic arthritis statements most accurate. A. Joint deformity. B. Progress to RA. C. Nonsteroidal anti-inflammatory drugs are the first choice. D. Minimize activity. NSAIDs are the primary meds for GIA. Question 311. Sharp object puncture shoe concern about osteomyelitis. Done immediately before. A. Admission orders. B. A blood culture is drawn. C. CBC. D. Parents arrive. Cultures first, antibiotics second. Question 312. Swelling lower affected leg toddler refuses to walk. Suspect. A. Possible fracture of the tibia. B. Muscle bruise. C. Fracture of radius. D. Mother carry. Question 313. Cerebral palsy information to parents? Select all that apply. A. Developmental screening. B. Injury to upper motor neurons. C. Milestones require no intervention. D. Parent support groups. CP is an upper motor neuron injury. Early intervention is essential. Question 314. Duchenne muscular dystrophy accurate information most. A. X-linked recessive, daughters 50% carriers, sons 50% disease. B. Both 50% disease. C. 25% chance. D. Sons 25%. DMD is X-linked, it affects boys, girls carry it. Question 315. PTCA procedure that. A. Surgical repair. B. Pacemaker. C. Procedure that compresses plaque against the wall to improve blood flow. D. Non-invasive scan. Angioplasty flattens plaque to open the vessel. Question 316. Hypothyroidism newborn emphasize. A. Mentally retarded. B. Administration of thyroid hormone will prevent problems. C. Hereditary. D. Growth delayed. Treatment with Synthroid prevents developmental delays. Question 317. Goal of involuntary hospitalization: A. Reorientation, B. Elimination of symptoms, C. Protection from harm to self or others, D. Independence. Safety is the legal requirement for involuntary stay. Question 318. Paralyzed car accident, I'd rather not talk about it right now. Mechanism: A. Suppression, B. Repression, C. Displacement, D. Projection. Consciously avoiding the topic is suppression. Question 319. Membranes ruptured for 36 hours prior. Priority nursing diagnoses: A. Tissue perfusion, B. Fluid deficit, C. Hemorrhage, D. Risk for infection. Question 320. Facilitate drying spica cast: A. Expose the cast to air and turn the child frequently, B. Heat lamp, C. Abductor bar, D. Turn as little as possible. Air dry only, handling by the bar breaks the cast. Question 321. Prepare the client for IVP test: A. Regular diet, B. Restrict fluid, C. Administer a laxative the evening before, D. 1 X-ray. The colon must be empty to see the kidneys on the film. Question 322. Acute glomerulonephritis understanding based on: A. Infection kidney tubules, B. Transmissible, C. Chronic respiratory, D. Response to a previous B. Hemolytic strep infection. AGN is an immune complex result of strep throat. Question 323. For infusing, finding report to HCP immediately: A. 3 episodes of vomiting, B. Periodic crying, C. Sucking pacifier, D. No measurable voiding in 4 hours. No urine in a dehydrated infant equals kidney failure. Question 324. Uterus boggy and bleeding, first action: A. Vitals, B. Massage the fundus, C. Bedpan, D. Lacerations. Massage stimulates the muscle to contract and stop the bleed. Question 325. Developmental dysplasia of the hip findings: A. Unequal leg length, B. Adduction, C. Pulses, D. Symmetrical folds. Asymmetry and limb shortening are signs of DDH. Question 326. Prevent a Valsalva maneuver in acute ME: A. Commode, B. Administer stool softeners every day as ordered, C. Antidysrhythmics, D. Bed rest. Stool softeners prevent the heart strain of pushing. Question 327. Trembling fearful initial response: A. Orientation materials, B. Introduce and accompany to room, C. Day room, D. Vitals. One-on-one safety is the first step in psych intake. Question 328. Chronic bilateral glaucoma associated with this problem: A. Blurred vision, B. Left side, C. I have to turn my head to see my room, D. Specs. Glaucoma creates tunnel vision, loss of periphery. Question 329. Low-pitched wheezes changed to high-pitched wheezes. Change indicates: A. Has increased airway obstruction, B. Improved, C. Suctioned, D. Hyperventilation. Higher pitch equals tighter airway. Question 330. Primary reason for administering morphine to me: A. Sedate, B. Decrease pain, C. Decrease anxiety, D. To decrease oxygen demand on the heart. Morphine dilates veins to lower heart workload. Question 331. Commonly responsible for myocardial infarction: Most: A. Aneurysm, B. Heart failure, C. Coronary artery thrombosis, D. Renal. Clots in the heart arteries cause the ME. Question 332. Supplemental medication frequently ordered in conjunction with furosemide: Most: A. Chloride, B. Digoxin, C. Potassium, D. Sodium. Lasix wastes potassium. Question 333. Serum glucose levels and free fatty acids are both increased post-ME. Changes are: A. Electrophysiologic, B. Hematologic, C. Mechanical, D. Metabolic. Chemical shifts in the blood are metabolic. Question 334. Third heart sound, S3, indicated by A. Ventricular dilation, B. Hypertension, C. Valve malfunction, D. Atrial contractions. S3 means the ventricle is overstretched. Question 335. Auscultation of crackles in the lungs anterior wall me. A. Left-sided heart failure, B. Pulmonic valve, C. Right-sided, D. Tricuspid. Left heart failure backs fluid into the lungs. Question 336. Diagnostic tools determine location of damage most commonly. A. Cath, B. Enzymes, C. Echo, D. Electrocardiogram. ECG leads show exactly where the heart is damaged. Question 337. Intervention for me first. A. Morphine, B. Administer oxygen, C. Nitro, D. ECC. Oxygen is the number one requirement for ischemic tissue. Question 338. Appropriate nursing response to me client fearful of dying, most. A. Tell me about your feelings right now. B. Fine, C. Situation soon, D. Assured. Open communication is the best therapeutic tool. Question 339. Protects ischemic myocardium by blocking catecholamines. A. Beta-adrenergic blockers, B. Calcium channel, C. Narcotics, D. Nitrates. Beta blockers stop the adrenaline effect on the heart. Question 340. Common complication of a myocardial infarction? Most. A. Cardiogenic shock, B. Heart failure, C. Arrhythmias, D. Pericarditis. VFib is the most common cause of post-ME death. Question 341. Jugular vein distension prominent? Most. A. AAA, B. Heart failure, C. ME, D. Pneumothorax. JVD equals systemic backup from right heart failure. Question 342. Position accurate reading of JVD most. A. High Fowler's, B. 10 degrees, C. Raised 30 degrees, D. Supine. 30 to 45 degrees is the assessment standard. Question 343. Parameter checked before administering digoxin. A. Apical pulse, B. BP, C. Radial, D. RR. Check apical pulse for 60 seconds. Question 344. See a green halo around lights toxicity from A. Digoxin, B. Furosemide, C. Metoprolol, D. Enalapril. Halos are a specific sign of digitalis toxicity. Question 345. Commonly associated with left-sided heart failure, most. A. Crackles, B. Arrhythmias, C. Hepatic engorgement, D. Hypotension. Left side equals lungs, crackles. Question 346. Sacral edema in bedridden client disorders. A. DM, B. Pulmonary, C. Renal, D. Right-sided heart failure. Right heart failure equals gravity-dependent edema. Question 347. Right-sided heart failure exhibit. A. Adequate, B. Polyuria, C. Oliguria, D. Polydipsia. Poor heart output leads to poor kidney output. Question 348. Maximizes cardiac performance by increasing ventricular contractility. A. Beta-adrenergic, B. Calcium, C. Diuretics, D. Inotropic agents. Inotropes increase the strength of the heartbeat. Question 349. Sympathetic nervous system produces A. Bradycardia, B. Tachycardia, C. Hypotension, D. Contractility. Question 350. Weight gain, nausea, and decrease in urine output associated with most. A. Angina, B. Cardiomyopathy, C. Left-sided, D. Right-sided heart failure. Systemic congestion signs. Question 351. Common cause of an abdominal aortic aneurysm? Most. A. Atherosclerosis. B. DM. C. HPN. D. Syphilis. Plaque weakens the wall of the aorta. Question 352. Abdominal aortic aneurysm commonly located most. A. Distal to iliac. B. Distal to the renal arteries. C. Branch. D. Proximal. Most AAS are infrarenal, below the kidneys. Question 353. Pulsating abdominal mass indicates A. Abdominal aortic aneurysm. B. Spleen. C. Distension. D. Gastritis. The aorta is the only artery big enough to cause a pulse in the belly. Question 354. Common symptom in AAA? Most. A. Abdominal pain. B. Diaphoresis. C. Headache. D. Back pain. Pain in the abdomen or lower back is the top symptom. Question 355. Rapid expansion and impending rupture of AAA. A. Abdominal pain. B. Pedal pulses. C. Angina. D. Lower back pain. Back pain means the aneurysm is stretching the space. Question 356. Definitive test diagnose AAA. A. X-ray. B. Arteriogram. C. A CT scan. D. Ultrasound. Arteriograms define the size and shape for surgery. Question 357. Complications greatest concern preoperative AAA. A. HPN. B. Aneurysm rupture. C. Arrhythmias. D. Pulses. Sudden rupture leads to death via bleeding. Question 358. Vessel layers damaged in aneurysm. A. Externa. B. Interna. C. Media. D. Interna/media. The media provides the wall strength, its damage leads to the bulge. Question 359. Abdominal aortic aneurysm assessment area commonly palpated most. A. RUQ. B. Umbilicus. C. Middle lower abdomen to the left of the midline. D. Right of midline. The aorta sits slightly to the left of the center.